Tonight's skit is entitled Health Information Technology, Past, Present, and Future. The story follows a patient with multiple health problems as she attempts to pursue healthcare in the local healthcare system. You'll observe her experiences in two scenarios, the past and the present and future state. You'll see how HIT has and will change the healthcare experience for patients and caregivers. Our story begins at the home of Ethel May. She, along with her daughter Susie Q, are preparing for her first doctor's visit in the North Country. Ethel May has recently moved to the area from North Carolina to be closer to her daughter.
Hi, Mom. How are you doing?
Hi, sweetheart. Not good. I got all this paperwork from my doctor's office that I need to fill out before I go in, and I just don't even know where to get started.
Well, let's see what we can do. Oh my, there's a lot of information they want from you.
I mean, shouldn't they already have this stuff on file?
Well, did you ask your doctor to send them your information?
Well, I thought so. I don't remember, and I can't believe I need to redo all this.
Well, let's see what we can do. Let's spend a little more time with it, okay?
All right, but I'm not spending a lot of time on it. I gotta watch Wheel of Fortune, and that Pat Sajak, he is just a hunk. Bless his heart.
I don't know that infatuation with Pat Sajak is an actual diagnosis. Probably should be, though. We just witnessed how difficult it was in the past for Ethel to share her information. She's done this kind of paperwork before. She doesn't want to keep doing it. Now let's look at how this experience can be improved by Health IT, today and in the future.
Hi, Mom. How's it going?
Oh, hi, Susie Q. I was just getting ready for my new patient appointment tomorrow with Dr. Foote, and I was just trying to get into my patient portal. Could you help me with that?
Yes. Let's sign you on. There. Now all you need is your password.
Okay, I'm not sure that I remember what it is.
Well, maybe it's a nickname that Dad used to call you.
Oh, it must be Sweetie Pie 1234.
We'll try that.
Okay.
See, you're in. Look, you have a message from the office. Let's see. Because your doctor used an electronic health record, they were able to retrieve all your health records. The only thing you will need to do when you arrive at the office is to sign a privacy and security statement. Please remember to bring your insurance card and all medications.
Wow, so they have everything on file already? I don't need to do anything?
That's great.
Wow, I can't believe how easy that is.
Do you have your medication all together?
I think they're on the kitchen counter.
Oh, let me see. Oh, okay. Here it is.
Oh, great.
So we're all set.
Oh, can't believe how easy that all was. That's so great.
Now what are you going to do for the rest of the evening?
Well, I guess with all this spare time, I can watch my Wheel of Fortune. That Pat Sajak, he is just so dreamy. Bless his heart.
Well, that infatuation with Pat Sajak is definitely still there. That hasn't changed. I think everyone will agree that Ethel's experience was dramatically improved with the healthcare IT sharing of information. Ethel now has access to her own information as she navigates the healthcare system. Let's watch as Ethel attends her doctor's appointment. Here we are at check-in.
Hi, can I help you?
Yes, I'm Ethel May, and I'm here for my 3 o'clock appointment with Dr. Foote.
Okay, I see you right here. Did you fill out your new patient paperwork?
Well, I tried, but there was just so much here, and I just didn't even know where to get started. I did the best I could, but...
Okay, well, we're going to need you to fill this out before you can see the doctor. Did you at least bring your insurance and ID?
I think so.
This is not an ID. This is a J.C. Penney credit card.
Oh, gosh.
Did you bring your medications with you today?
Yes.
Yes.
Susie Q, do you have those for me?
I do. Here's their
Okay.
medication.
I will have you hang on to those. You're going to have to fill out this entire paperwork before you can be seen.
There's just so much there. I don't even know where to start.
We'll see what we can do, but maybe it's something somebody else can help us fill.
Okay.
So, we've just witnessed Ethel's frustrations. She doesn't think she has the ability to remember all the information requested, and she questions why she has to keep providing information that should already be in her records. Let's take a look at how electronic information flow can improve Ethel's experience.
Hi, can I help you?
Yes, I'm Ethel May, and I'm here for my 3 o'clock appointment with Dr. Foote.
Okay, I see you right here. And it looks like we already have your information from the patient portal.
Oh, wow.
We got your medical records from your previous doctor in North Carolina via the HIE. I just want to verify a couple things with you. You live at 84 Sunset Lane.
Correct.
Is that correct?
Yes.
Your phone number is 315-782-2234.
Correct. Yes.
And you have Medicare?
That is right.
Okay,
Yes.
I just need you to sign one form, which is
Sure.
the Privacy Act, and we
Sure.
will be all set. Did you bring your medications with you today?
I did. Yes. My daughter Susie
Okay.
too has those.
I'll have you hold right on to those, and the nurse will be right out to get you.
Oh, great. Thank you so much. That was so easy.
You are so welcome.
Bless your heart.
We've just seen the positive impact of a patient portal and health information exchange. Ethel's experience has obviously been improved, and the doctor's practice has the information it needs, when it needs it, in the right place to provide optimal care. Now let's witness the patient visit as it was in the past.
Hi, Ethel May.
Yes, that's me.
Susie Q.
Hi, Susie Q. So, you're here today because you're having some difficulty breathing?
Yes, that's right.
Okay. Looks like we got all your paperwork here. Oh, there's lots of empty spaces here. Did you have a hard time filling that out?
Yeah, there was just so much there. I didn't even know where to get started. And shouldn't you already have this on file?
Well, when was the last time you were at the doctor's office?
Oh gosh, I don't remember. Do you
It's
know?
been over a year, Mom.
And you just moved from North Carolina?
That's right.
Do you know the name of the doctor you saw in North Carolina? Maybe we could try to give him a call?
Dr. Shu.
Dr.
It was
Shu,
Dr.
that
Shu,
sounds right.
okay.
Yes.
All right, well, let's see. Well, the new doctor that you're seeing today is Dr. Foote, and he's going to have a hard time trying to help you out with all these empty spaces, so we're going to have to see if we can call and get that other information. How about medications? Did you bring your medications with you today?
I did. Yes, they're right here.
Wow, okay, let's see. You listed a few things here, but there's a lot more in this bottle than what we've got. Oh dear. Let's see. Okay, this one's here. This one's here. Okay, these two here, these are the same medication. They just have different names. You see that? That's just the generic name for the same thing. Do you take both of those?
I do. I take everything that's in that basket.
Oh, you take everything. Okay. Well, Dr. Foote will have to just try to go through those with you a little better. Maybe he can help figure that out. So, do you know when the last time you had some of these renewed, or you just don't?
I don't even remember. No,
Okay.
it's been a while.
Okay. And you don't remember the last day you saw your doctor before you came
I
to
don't.
North
I
Carolina?
can't remember. No.
Okay. All right. So, trouble breathing. That's why you're here today.
Yes.
Okay. Anything else we can help you with today?
I don't think so. That's
No?
it.
Okay. Well, the doctor will be in shortly, and hopefully he can maybe help you try to remember some of this history that's missing here from your file, okay?
Okay.
All right, he should be right in.
Thank you. Thank
Okay.
you.
It'll be okay.
Come in.
Hi, I'm Dr. Foote.
Hi, I'm Ethel May.
Nice to meet you.
Susie Q.
Hi, nice to meet you. I'm just going to pull up a chair here. So I hear you're all the way from North Carolina, huh?
That's right. Yes.
Okay. Is it our weather that brought you up? Or?
Yes, I heard wonderful things about the winters.
They are. They're very good. So, you know, I haven't gotten much of a chance to look through this, but tell me, oh yeah. So what brings you in today? What's going on?
Well, I've just been having some trouble with my breathing.
Okay, like is that a new thing or not new? Or
No, not new.
Okay, is it getting better, worse, staying the same?
I would say worse.
Okay, over what period of time do you think?
Oh, I don't even know. Probably a couple of years at least.
Oh boy, yeah. Yeah, it looks like a whole bunch of medical issues here. Have you had an echocardiogram, an ultrasound of your heart recent?
I think I
You know, they do
have.
the picture. Do we
Yeah,
know,
I
or-
definitely have. Yeah.
But it's been a while, Mom.
Yeah. And then blood work.
Yes.
Like recent or?
Do you not have any of that
No,
there?
not really. I just see some of the diagnoses here, and there's a little bit of lab work, but I can't tell. It's been over a year that. Not so sure. How
No,
about
I-
breathing tests? Have you had any of those? Or?
I can't remember. No.
Okay. And you're taking this one and this one?
Yes.
These two? You take them both?
I do. I take
Like
everything
every
that's
day
in that
both, huh?
basket. Yep. That's what I was told
All
to
right.
do.
All right. You know, I think I'm going to need to get lab work on you again, and an echo, an ultrasound, probably some breathing tests because you got multiple problems.
But I've already had all this done,
Well, but
and I just want to feel better.
Yeah, but I don't have anything that's recent here, so before I can really give you good advice, I'm just going to need better information. I'm sorry.
Okay.
All right. You can go ahead and check out. They'll tell you how to do all the appointments up there, and I'll see you back in a couple weeks.
All right, well, thank you, doctor.
Yeah, you're welcome.
It's okay to have those tests again, Mom. We want to make sure that he has the right information.
I just want to feel better.
Once again, we see the frustration for the patients and the caregiver caused by the lack of having the right information in the right place at the right time. It's frustrating for both of them. The caregivers lack the information they need to take care of the patient, and they might have to order tests that have already been done. Let's see what the visit would look like when the right information is available in the right place at the right time.
Hi, Ethel May.
Yes, that's me.
Susie Q.
Hi, Susie Q. So, it looks like you're here today, you're having some trouble breathing, is that correct?
Yes.
So we were able to get all of your information from your previous doctor. You saw Dr. Shu in North Carolina?
That's correct, yes.
And you just moved up here recently, right?
Yes.
Okay, great. Looks like you also have COPD and depression. Okay, and we have all your medications listed here. It looks like you just filled those all about a month ago, just before you moved.
That
Is that
sounds
right?
about right,
I
yep.
see you brought your basket with you.
I did.
Let's just see here. It looks like everything is about the same as what we have here. Let's see. And you just had some blood work done before you came too, and an echocardiogram.
Yes, that sounds right.
Great. We have all those results here. We were able to pull all that information down from the Health Information Exchange.
Wow.
So Dr. Foote, when he comes in, he'll be able to review all those results with you for your visit today. Let's see. Looks like everything we need is right here. The medical assistant got your vital signs. They look great.
Great.
So Dr. Foote should be in shortly. Anything else we can help you with today?
I
Anything
think
other
that's
than
it.
the trouble breathing?
Just the breathing.
Okay. Great, great. Dr. Foote should be right in.
Well, thank you so much.
Thank you. Boy, that was easy.
I can't believe how much easier that was.
Bless her
Bless her
heart.
heart. Come in.
Hi there.
Hi.
Dr. Foote.
Ethel May, nice to meet you.
Nice to meet you.
Susie Q.
Hi, nice to meet you. So I understand you're coming up from North Carolina.
That's correct.
Couldn't
yes.
get enough of the cold weather there, came
Nope,
up here.
just love the skiing.
There you go. I can tell you're an avid skier. So I got a chance to review things through your records, so things look pretty good. But what can I do for you? What's been going on?
Well, just been having some shortness of breath, and I didn't know if you could help me out with that.
Okay. Has that been getting worse recently?
Yeah,
or-
I would say it's been getting worse.
Okay, gradual or all of a sudden?
I would say gradually.
Okay. All right. Anything else going on, new or different?
Just the breathing, I think.
Okay. I had a chance to look through your medications here, and I see you've switched from a few from like a trade name to generic, but that's a normal switch, and you're taking them the right way. I checked back through.
Okay, great.
So I don't think it's anything you're doing. But if you look here, there's a couple different, these are called pulmonary function tests.
Okay.
And see this number here keeps going down each time you have it?
Yes.
I think your lung disease is getting worse.
Oh, no.
Yeah, so what we're going to do is I'm going to send in a prescription medicine that helps with your breathing. And it should open things up and allow you to breathe more easily.
Okay.
And we're going to have you start that right off, okay?
Great.
I don't think you need a big heart workup or that sort of thing at this point. I would like to connect you with one of our case managers who can help with setting up your medications, answering questions about these specifically, and also going over signs and symptoms to watch for if your symptoms worsen.
Great.
And you can do that. The number will be right available at checkout for
Okay.
you, along with making a follow-up appointment and instructions on the medicine and the specifics of any side effects to look for there.
Okay.
So I really expect you'll feel better in the next week or two. And if not, you'll know the right people to call.
Great.
Okay? Any
Well,
other questions?
That would be so helpful. I work such crazy hours. If
Yeah.
there's someone else you could contact.
Yeah, and this is a lot of responsibility. So let's get someone who can help us out as well.
Great. Well,
All
thank
right.
you so much. I appreciate it.
It's a pleasure meeting you both. Welcome
You
to
as
the
well.
area.
Thank you so much.
Yep.
Wow. I can't believe how great that was. He is just so awesome. Bless his heart.
We've just seen that when the right information is in the right place at the right time, caregivers are able to make informed decisions, avoid redundant tests, and ultimately partner with Ethel to create a customized care plan. Next, we see Ethel having a bit of trouble.
Oh, goodness. I just can't breathe. Oh. I don't even know what to do. Oh, I gotta call Susie Q. She'll know what to do. 555-1234.
You have reached Susie Q. I can't come to the phone right now. Please leave a message and I'll get back to you as soon as I can.
Oh, no. What am I gonna do now? Oh, I can't breathe. Maybe I need to call my doctor's office. I think I have a sheet of paper here with his number on it somewhere. Okay, there it is, Dr. Foote. 555-4321.
You've reached the office of Dr. Foote. The office is currently closed. If this is an emergency, please hang up, dial 911, or go to your nearest emergency room.
Oh my goodness, I can't breathe. I guess I'm gonna have to call an ambulance. I gotta call 911.
Now that was a scary situation. Are there other ways Ethel could receive help other than the ambulance or the emergency room? Let's watch.
Okay. My doctor told me not to panic if I feel short of breath. I need to call my care coach. I think her name's Patricia here. I think I have her number. All right, I'm gonna call Patricia. 555-5678.
Hello, this is Pat.
Hi, Patricia. I'm having a little bit of difficulty breathing, and my doctor had told me to call you if I was experiencing any shortness of breath.
Well, Ethel May, I'm sorry you're feeling that way. Can you tell me exactly what's going on?
Yeah, I just feel like I can't catch air. I can't catch a breath.
Oh my goodness. One of the things that we talked about, did you take your medicine today as you were supposed to?
Yes, I think I took it this morning.
But you're still having some difficulty breathing?
Yes, I am.
Well, when you and I sat and talked about your plan, do you remember what we talked about if your breathing became difficult?
Well, I remember meeting with you, but I don't really remember what we talked about.
That's okay. One of the things we talked about is that you would take your prednisone pill with a full glass of water. Have you taken that pill?
No, I have not.
All right, well, let's stop a minute. Why don't you go ahead, take that pill, and I'll wait here on the phone.
Okay.
Now, that's going to take a little while for that to get into your system. In the meantime, I'd like to make sure that you understand the instructions because there were other steps involved. Do you remember what we talked about?
I think I remember something about putting my lips together when I take a breath.
Oh, all right. And you were suffering from a little anxiety?
Yes, that's right.
Okay. So why don't you take, can you take some of those breaths for me?
Sure.
Yep, you're doing it just right. Take a few more for me. Do you feel a little bit better?
Yes, I think I do feel a little bit better.
All right, that's great. Why don't we continue to talk a little bit and talk about those other steps?
I don't really know that I remember all of them. All I can remember is the breathing. I'm so sorry.
You've got nothing to apologize for. One of the things I think it's going to be important is I think that you need to visit your doctor's office tomorrow.
Okay.
All right, are you going to be able to get there?
Yes, I think I can find transportation.
All right, good. I think there's one more step that we're going to talk about. Do you remember what that is?
I can't remember. I'm so sorry.
Oh my goodness, it's okay. One of the things that we talked about is if you continue to have trouble breathing tonight, you can give me another call.
Oh, that's so wonderful.
Are you starting to feel a little bit better?
Yes, thank you.
All right, well, why don't we do this? Tomorrow morning, unless I hear from you, you'll show up at your doctor's office tomorrow at 8.
Okay, I think I can remember that.
All right, and again, you can call me if you continue to have problems.
All right, great.
All right, you have a good night, Ethel May.
Thank you so much, Patricia. Bless your heart.
Thank you, everybody, for your attention. If we can get the North Country HIT players up here, we'd like to give them a round of applause, please.